This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about creating transparency in the beauty space. I'm Mackenzie Westmore.
And I'm Dr. Paul Nansen. Hey, like your cheeks, your makeup, especially right now today, it's just luminous. It's beautiful. You did a great job.
Like it?
Yeah.
Thank you very much.
Do you know a little thing about makeup, maybe? Or
Just a few things. Not the best, but
yeah.
You know, actually, all jokes aside, I do joke about this, that coming from a family of makeup artists, that it skipped a generation with me because I'm not a makeup artist, but I do say that I bleed mascara.
There we go. You bleed mascara. I love that. Right.
It's just in the genes.
So
how are you doing? Good.
Working hard in between patients again, when I love doing this and taking a break. And, I think we're going to go through some kind of cool questions, which is great because these are questions from our audience. And so we're going to spend some time answering them.
I love this. So kick it off. You're the first one I see on the list.
To me, do you believe AI, artificial intelligence, will take over the medical world? Well, first of all, just to let you know, they already have robots in surgery, but right. Again, someone's controlling the robots. Da Vinci, and they're doing a lot of head and neck surgery. They're doing actually abdominal surgery with that, general surgery. So they do that, but again, that's not AI. I do know. It was interesting. I went to one of these the AI chats, and I said, "How do you do a rhinoplasty?" And it populated after about 30 seconds or some crazy time like that. And it was pretty good. I mean, it really wasn't bad. I think that AI is going to have a place in medicine. But when it comes to medicine, I feel that you can't, like in movies and stuff, they always use robots and AI and stuff like that. But if you notice, there's always a human that's part of that. So I'm going to say, at least in my lifetime, I don't think AI will take over. Do I think that it will be important? Yes. Mm-hmm. But I would hope that it doesn't take over. That means we would obviate the need for humans. No more doctors.
Yeah.
I don't think so. So there's my first question. Your turn.
My turn. So how do I think AI will affect the field of makeup? We're already seeing it be affected. I think one of the best examples for both you and I in our industries and our fields was actually, I don't know if you've seen it yet, but the newest Black Mirror. And there's a whole episode about AI and how it's taken over, and Selma Hayek's likeness is being used in a Streamberry, which is a Netflix show. And it's a fascinating take on what we're already seeing in some ways.
I heard about that. I heard about that show.
Oh my God.
I hear it's pretty cool.
You've got to see it. I plowed through every episode. There's one I'm missing, actually.
It's called Black Mirror?
Black Mirror. It's so good. But that particular episode is actually a little scary because of the AI concept and terms and conditions. Because it's, who really reads their terms and conditions when they sign up for a lot of these things?
That's
and
right.
It's really a commentary of, you better read those things. I don't want to give anything away. Just from here on out, Dr. Nelson, read your terms and conditions, please.
Yeah, so I got to start doing that.
So going back to this, with makeup, we're already seeing it to a certain degree because really, you pick up your phone, you can go on Amazon, you can look at a lip gloss and put your photo in, and it'll show you how the lip gloss or the lip liner or how the makeup looks on you. So we're already seeing little bits and pieces. Now, there is a fight going on right now for actors, and SAG looks like it's going to strike because of AI.
Really?
And yeah, because of AI taking over and actors' likenesses. And as actors, we're fighting against that.
Well, wait a minute. Can you explain what you're talking about? What do you mean take over?
Yeah.
Help me with that.
Meaning that, if AI takes over, and in taking over, meaning that as actors, we give up our likeness, or you have the big, like I said, the Selma Hayek in this Black Mirror episode gives up her likeness, which means that they could take your face and use it to any capacity they want, doing anything they want, which is a terrifying thing. And it's a fraction of what I'm hearing. The money that would be given is a fraction of what is being paid out now. So that means anybody's likeness could be used absolutely anywhere and make very little money. So if that's the case, where we see that happen with actors, because we're already seeing it with writers, who's to say that's not going to replace makeup artists someday? That's a scary thing.
So you're telling me that if you sell your likeness for like this movie, Black Mirror, you said Salma Hayek or whatever.
Yeah.
Or if that's what, does that mean they can make that AI or whatever it was act or something? So,
yep.
So in other words, when you're seeing someone act on TV, it's not really them, it's artificial intelligence?
Correct. It's an artificial intelligence. I don't know to what degree it's at right now. It might be that it's somebody else in, those like green screen suits with the little dots all over them. I don't know if that's exactly what it is, but they plug on the face of a celebrity. So It's a little scary. Yeah, it's a little scary where the industry is going. And that's why there is a fight against it. Now, when we talk about makeup, I mean, that would just be a natural progression. If you're replacing writers and actors, well, why isn't makeup eventually going to get replaced? Now, if you're talking about makeup products, I don't personally, I don't foresee, just like you, I don't see that happening in my lifetime because women love to wear makeup. Humans still exist. The day robots take over the world is the day we will lose all makeup.
Very interesting. All right, here's my next one. Is the show Nip Tuck accurate to the plastic surgery?
Ooh,
so
that's a good one.
Yeah, I used to love watching that.
Me too.
And actually, our working title for Botched was Nip instead of Tucked. Replaced the T with an F. So when we went to pitch it, it was Nip.
I love that. Wow. Why did it get changed? And so, first of all, why did it get changed? And then, is Nip Tuck accurate?
So one, you can't use that. Hey, Nip effed. You can, maybe you could do F, apostrophe ED, whatever. But it's still, when we went to all the interviews, and we were pitching the show originally, it was that. And then I think, if I'm not mistaken, he came up with the name Botch, which of course is a great name.
Yeah.
No, of course it's. I mean, a small part could be accurate, or the ideas could be accurate, but taking it to the next level, what they did, whether it was, the doctors using drugs and these crazy surgeries and having sex with the patient on the operating room table and all that stuff. No.
Oh, come on, Dr. Nassif.
I'm sure something like that could have happened with other doctors' offices, and I'm sure it just was taken to the extreme limit. But it was a great show.
Yeah.
So is it realistic in real life? No. Maybe dumbing it down by about 90%, then you got real plastic surgery. Now, in my office, in my life, without the drugs, sex, and rock and roll, or maybe the rock and roll, my office will be not as mellow as maybe a regular plastic surgeon, because we have so much stuff going on, So anyway, we're always having fun. All right, your turn.
Your office is awesome. That's all I got to say. Okay, so mine now. Do you still keep in touch with anyone from Face Off? Actually, absolutely everyone. It was very much a family show. And you got to remember that, my dad was the mentor. So there's number one. I married one of the judges. There's number two.
Wow.
So the other judges, Glenn Hetrick, I still keep in touch with. V. Neal, still keep in touch with. Neville Page actually designed an alien for me on the latest Picard. And he, as a tribute to my family, called it Romsu, which is Westmore spelled backwards. And I got to go on and play it. So that was, the fun that Neville and I have. And as far as the producers go, I still keep in touch with them as well, because they became brothers to me. So it really is, it was, and it still is a family show.
That is kind of cool, especially your dad is the mentor, which, he's great. Love those stories.
Yeah.
All right, here's my question. Can you tell if someone has had work done but won't admit it? So if the work, if anyone can tell if you've had bad work, because you can see it, whether it's the nose, the eyes, the face, the breasts, whatever it is. So that's common sense for all of us out there to know somebody had plastic surgery because they look usually odd or very different. Now, if it's a friend of yours and they had good plastic surgery, or if someone walked down the street and their face looks good, their eyes look good, their nose looks good, but they look natural, you might say, well, that person at 65 really looks good. I'll bet you she had her eyes and her face done.
Right.
But good plastic surgery in general, it's not obvious. They just look good, unless you see it before and after.
And have you ever had a patient that has lied to you?
All the
And
time.
you nailed it?
All the time.
Really?
Never had a
Really?
facelift, never had the eyes done. And I'm examining them, I see scars and all that. I go,
hello.
sorry, but you did, you know. Or I never had my nose done. We go inside, it's all scar tissue. Yeah, and you
Oh my
did.
God. That's so stupid that people lie. I'm sorry.
That's okay. All right, your turn.
All right, my turn. Okay, your makeup in Star Trek Picard, okay, there we go, was so intense. How long did it take? Is it hard for you to sit still so long?
Wait a minute.
It wasn't.
Hold on.
So I played an alien on Star Trek Picard.
Were you a recognizable alien?
No, not
So
at
it was
all.
kind of like an extra kind of thing?
Here's the thing that stinks is that they were going to make it a more regular character, and I had an issue with at the time. Now, here's something that involves you, Dr. Nassif. I had an issue with the smoke on set, and this is right before you and I did surgery. Come to find out that really I wasn't having lung issues. I was just sick from too many fillers. So I wish I had done Picard after our surgery because I probably would have been able to withstand the smoke better.
What's smoke?
So on set, they like to use fake fog, smoke to give atmosphere. They did that on Face Off, and it drove me nuts. And they did it on Picard. The tough thing with Picard is that because my face was fully covered, bald cap, everything, had a white wig. Every piece of me was covered. It was difficult to breathe in that makeup anyhow, because the nose, it was this little like, almost like from a Whoville kind of nose, and it came all the way down to here. So two tiny little nostrils to breathe out of. So it was a lot of mouth breathing. So that made it a little more difficult, but I think I could have handled the smoke a lot better post-surgery. So going back to the question though, it was an intense makeup because it was a full face here, all the way to here. It wrapped around here. It came all the way, bald cap, wig. And then you got to remember the costume is almost like what I'm wearing, but a little higher neck, a little tight costume. I remember we were filming in Santa Clarita in the middle of the summer.
Oh,
and it was 3 digits, and I'll never forget that heat was just so intense. And they can't really keep the air conditioning going on sets like that because you've got the foggers, you've got the smoke to give that atmosphere. So it was pretty brutal. And the makeup itself, they moved pretty quick. I would say it was maybe 4 to 5 hours of makeup. They take breaks here and there. It was far worse for me when I did Face Off because that was 12 hours. And that was 3 characters back to back. So 12 hours was tough. It starts to get tough after a while, especially having Tourette's. Like it's a little tough to stay still.
Oh my God, that's so, when you say that, I hate saying, listen, I'm sorry, you got Tourette's, but the way when you make fun of it yourself.
Oh, yeah.
You're allowed to make fun of it, but no one else is, obviously.
Can I tell you there's an episode of South Park that is my favorite episode, and it's based around Tourette's, and it is so wrong. It is so not PC, but it is so, as somebody with Tourette's, it is so freaking funny. Because like you said, I don't care. To be honest with you, I don't care if anybody else makes fun of it. I'm not sensitive. Like I'm not a little flower. So I don't care. It is what it is. I have tics. And it's, it's part of the deal. It's part of who I am. So I kind of like it. It makes me who I am.
You don't have the tics where all of a sudden you'll be talking to someone, all of a sudden you'll swear. You just come out.
No. So that's the misconception with Tourette's. Is it's almost like how they say with autism, there's varying degrees. Same thing with Tourette's. When somebody is swearing Tourette's, that's like all the way over here, where it's like maybe 5 to 10%. It's a very small, maybe 5%. It's a very small percentage. My tics will come out more in blinking too much. One thing my son discovered was that I always knew that I did this, but I squeak like a mouse when I cook.
Wait a minute. What?
I know.
Can you tell us a little bit, or can you imitate that a little bit?
I can. In fact, the first time it happened, I was in class and I used to put myself in the back of the classroom because I would squeak and they'd be like, "What is there a mouse in here?" And I'd be like, "What are you talking about?" So in school it was tough, but it's more like a,
Oh my God.
yeah. So that's why
That's kind of cute though.
I guess, but it's a little frustrating because what it is, I'm trying to hit a pitch. And so that's where like the OCD kind of sinks in. And for some reason, it's only when I cook. I don't know why, but it's only when I cook. So I think as I'm so focused and when I get hyper focused like that, I'm like in the kitchen. So that's my Tourette's.
I kind of like that. That's interesting.
Thank you, Martha. Thank you.
Well, we learned again something. All right. My turn. Have you ever had to sign an NDA for a client who doesn't want people to know they've had work done? No, we don't sign NDAs.
Really?
No, because as a doctor, at least I never had to. You know, it's not like you bring an NDA. It's basically it's HIPAA, so we have to be compliant automatically, and so you can't. It's an automatic thing if you just let's say I did surgery on an A celebrity, and they can't or you can't. Unless they give you permission in writing, like we did with you, to use your photos, a consent. If they and remember, they have to sign a consent, and all the time they're going to say no. And so that's your thing. So the bottom line is, you don't need an NDA because you're as a doctor, you're at a higher level of confidentiality. Then if you break that, then they can make a complaint to the medical board. They can sue you, can do all those things.
Oh, wow. Yeah, so it's not really it's not an NDA, it's just HIPAA. You're a doctor, so that's, you can't
especially
release.
social media stuff. I mean, I will tell you something. Years ago, a friend of mine had the permission slip about social media, and he thought it said yes, but it said no. And the person put someone on one of the sites, one of the posts for maybe 15 to 20 minutes. Realized I made a mistake and pulled it.
Oh my gosh.
Patient still got in trouble. I mean, the doctor got sued a little bit.
Oh no.
Yeah, you can't do that. So you have to be careful.
All right, next one is you.
Yeah. Can you negotiate prices with your surgeon? I think the more successful you get and the more your time is limited, if you're busy, the answer is no. However, if you're afraid, I mean, there's discounts given. Can't really negotiate, but if it's friends and family, or if it's a newer doctor starting out and wants to get more cases in to build up their portfolio of befores and afters, you can kind of negotiate if you had to. You can say, hey, I'll do your social media and I'll give you a 20% discount or whatever. So you kind of can, but it's not really professional from the Board of Ethics standpoint of doctors negotiating with patients.
Oh, interesting.
In regards to that.
Good to know. That's a great response.
Your turn.
My turn. Best facial products for combination skin. Well, obviously everybody knows that Hydroscreen is my go-to. And I do have combination skin. I also have eczema. I find the Hydroscreen is my daily go-to morning and night for calming my skin, for keeping it supple and hydrated. As far as like I would say like other lines that I do enjoy outside of yours, Dr. Nassif. I do like SkinCeuticals. I do feel they're a good one for combination skin. I do like Skin Medica. You know, I get asked so often about skincare products, and I always tell people, well, there's medical grade and then there's spa grade. And that's kind of how I see the world of skincare products. Now, yours obviously goes into medical grade. I prefer medical grade because I want to see changes. I don't want to smell like, a spa. I don't care about that. I want changes. I want to see differences in my skin. So the ones that are more spa level, I stay away from because it's just a waste of money. I want things that are going to make a difference and going to change my skin and keep me looking my best. So that's my answer for combination skin.
Beautiful question. Should you bulk surgeries together, and does it pose more risk?
Oh, that's a great question.
So, if you think about it, it's nice to bulk or do combination of procedures. A lot of patients will come out wanting their nose done will fly out, but then they see their neck, their face, and they'll add on in maybe a lower facelift, a deep point facelift, and eyes. So the good thing about that is you're healing all at once.
Mm-hmm.
When you're doing your nose and you're doing these other procedures. You're healing all at once, one anesthesia. Yes, albeit maybe a longer surgery. But when it comes to face surgery, especially if the doctor does a good medical workup, sends you to get a good medical workup, EKG, blood work. And for me, if you're over 50, you have to go get a cardiology workup, stress treadmill test. If all of that is perfect, then there's no problem doing it. However, anytime when you go into a longer surgery with face surgery, you're giving less gas, less anesthesia, because we're using a lot of local medication in the area. So I'm going to say it's a little bit less, risky, shall we say, because it's kind of a light anesthesia. But when you're doing big body plastic surgery and there's a lot of fluids being lost, fluid shifts, then it could cause a problem. But I get everyone over the age of 50 to a cardiologist, by the way. All I have to get a cardiology workup and treadmill. All of them do.
Now, I'm curious, is there like a time frame of how long a surgery can go on for? Is there like a cutoff time where the body just can't handle it?
I don't think there's not like really a set rule of, hey, you have to stop and blank amount. But when it comes to body surgery, where you're losing on those fluid shifts, it might be 8 hours.
Okay.
I mean, that's recommended. For face, probably a little bit longer.
When you talk about fluid shifts, what do you mean by that?
Well, when you have long surgeries and you're either doing a lot of lipo, or you're losing a good amount of blood, or you're infusing tumescent fluid in them, you're going to absorb a lot of that blood and a lot of that fluid in your system, and you might get a little bit dilute. You're between your blood and all the fluid in your system. So you have to be careful of that.
Mm-hmm.
Doctors have to be careful of what you're doing, because also if you lose a lot of blood in the middle of doing liposuction and you really don't know you're losing a lot of blood and you're giving a lot of fluid, it can be harmful on the system. So you just got to make sure the doctor you go to is very reputable and just really knows her or his stuff for that procedure.
Now, I know you've one more question, but I got a question.
Go ahead.
Through your years, botched, not unbotched, what is the maximum amount of surgeries you've seen performed on one person at one time?
Probably 12.
What? Whoa. What were they?
Well, this is years ago, but face and neck, upper eyes, brow, lower eyes, fat grafting, lip lift, nose job, laser. And then there's some other things I'm forgetting.
Oh my God.
Oh, chin implant too.
Wow.
So I've done those, and those are maybe a little bit longer, but as long as the patient has had complete full workup.
Yeah, because I remember when you and I worked together, I was really impressed with all the different steps and different doctors you had me see to make sure between seeing an eye doctor for ptosis, between seeing, I was really impressed by that because I don't think a lot of surgeons do that. I haven't witnessed that with friends.
Yeah, I don't know. Every doctor's different, but I make
Mm.
everyone, no matter their age, go get a medical workup and EKG. I don't
I think
care
you're
your
smart.
age,
I don't, yeah, you're
because,
smart.
you can always diagnose something that the patient doesn't know about, and then the patient could have a problem. So my
Right.
goal always is to make sure that each patient gets a complete workout, no matter what the age is.
So smart. All right. You got one more question here.
So are non-surgical treatments as good as surgery for certain procedures? For example, fat reduction with double chin versus chin augmentation, liposuction. So there's certain, whether it's cool sculpting or the injections, the oxycolic acid to melt fat in the neck, other parts of your body, sometimes you can get results which are just as good as liposuction, for example. But when it comes
Wow.
to the chin, you might be able to get a nice result just doing, shall we say, chin cool sculpting versus a chin implant, neck lift, platysmoplasty, and skin tightening. But, it's something that, let's say this one was fat reduction for double chin versus chin augmentation. So if you do have, let's say, cool sculpting, you're going to solve this. But if I was going to do a chin lift, I'm going to make a decision here, do some conservative liposuction, go underneath the muscle, work deep to the muscle, a deep neck facelift or a deep neck lift. And then you're going to put it together and you have a little bit of a bed of fat in your skin, and God willing, you'll heal well. And you're able to do more contour work versus if you're just doing a little bit of a small incision here for a chin implant, which I help with this, and a little bit of liposuction. That can be just as effective as sometimes, but surgical results are always usually going to be a little bit more effective than non-surgical. It's a
Mm-hmm.
rare occasion. I mean, like fillers and all that stuff, yes, you can do that beautifully. Or sometimes with the products like Botox and stuff, sometimes there are things you can do better than doing something surgical. So you always want to, consider, okay, what can we do to minimize risk,
Mm-hmm.
make the patients happy, and kind of, you know, uh, give them what they want. But as long as you explain between non-surgical and surgical, what the limitations are.
Because you're limited, obviously, with non-surgical. But if somebody doesn't want to go under the knife, there are options that could make a difference.
Absolutely. There's the microneedling with radio
Right.
frequency. There's radio frequency alone. There's lasers, there's peels. Um, there's, hair transplants. I mean, there's all kinds of procedures, skin tightening that are happening right now.
So I got a question for you. I'm sorry, I keep adding on to your questions. When it comes to like somebody they asked about fat reduction, is it, correct me if I'm wrong, is it Kybella?
So Kybella is the deoxycholic acid. That's where you inject.
Mm-hmm.
And Laura, the nurse practitioner, does that and liposuction. And she's very conservative. I've been doing this for years. And she gets, every time she does it, thank God, knock on wood,
Would.
she gets
Yeah.
a great result. You don't want to use that every time, but it depends on what you're trying to do.
Can that be injected in different parts of the body?
Well, I don't think it's FDA approved, but I know that people have injected the deoxycholic acid in different parts of the body. Sometimes it's worked okay, but most of the time when I see patients that have had it done, they don't look good.
Really? So it's not like you can sculpt a six pack with it.
No, no. Because you don't know the result you're going to get. So sometimes you may not get the best result, then you're screwed, basically. Simplest terms.
And how long does that last?
I think that's where that fat there, because you're killing out the fat cells. I think it might be close to being a decent amount permanent.
Interesting.
With all these procedures we do, especially inside the skin, I think that's taken someone already right there that has bad skin, or has had bad treatments with lasers, and doing all these things, getting things corrected. Sometimes a combination of hands and the laser can do the best job, because it depends on technique and it depends on who's doing it, and the laser, the quality of it. I had a Moxie laser a week ago.
How are you liking the Moxie?
I love it. I mean, you can't tell, but I'll tell you one thing.
Your skin always looks
Botox,
amazing.
yeah. So it was good.
Can you explain really quick what the Moxie does?
It's the laser helps with texture, a little bit tightening the skin, discolorations, like brown spots. And so it kind of rejuvenates your skin, also great for precancerous, lesions.
Oh, wow. Good to know. Might be sending some people your way.
I think we have one more. I'll let you go for it.
So, favorite episode we have done so far. Oh my God, that's a hard one. Because each week I feel there's something totally different that comes up. So it's such a difficult one to answer because we've had everything from just you and I chatting to Ed and Michael from Evolve to the doctor, oh my gosh, the doctor for the bariatric surgery. That was fascinating. Kirby Johnson. Okay, I mean, we've had I feel like every single week I learned something new. So that's just too difficult to say favorite one so far. I love them all.
Yeah, I think there's one we're going to be coming up with in film yet. It involves Evolve. That might be cool too.
That one I think is going to be really fun because I both of our results are in. So I'm so excited to be able to compare notes with you.
Oh yeah. Oh, your results, you had it done too?
Yes.
All right. So yeah, I'll be interested because, I got them when they got sent to me and I didn't understand a lot of it. So looking forward to it.
Oh, you're in for a treat. I got to tell you.
So that will be fun.
Yeah. Having your results, you're in for a treat and a life change. So yeah, I think we've got a lot of fun ones coming up, but I don't know. Do you have a favorite one so far?
I think this one coming up will be my favorite.
This will be
the one that we're talking about filming. And I think probably so far, and we're going to probably have Dr. Dan DeLion on, going to talk about anti-aging medicine a little bit more. But I think our cardiothoracic, our surgeon, the bariatric surgeon, I think talking about the semi-glutides and all that was fascinating.
Yeah.
More about that. And also, we have the semi-glutide Ozempic face or body post-weight loss, and then they need a lift automatically. So if you're going to do something, you have to really, know what the ramifications are. But I think that was because I learned a lot. So now it's my favorite.
Yeah, that's how I felt.
I learned a lot.
That's how I felt. That you're right. I have to say with that one, I learned the most on that one. And for that reason, that would have been probably my favorite. But they all bring something amazing, interesting. Kirby's made me laugh like crazy because that was just funny.
There we go.
I know you were dying on that one.
I love it. That was it. So, I mean, we've had some good stuff, but I think we got a lot more to go, especially as we keep diving into this. We're just going to keep increasing our, as people reach out, then they reach out to us and say, hey, I want to be on your podcast. And especially, but the thing is, as long as it's something that's real about inside and out, beauty. Yeah. That's where it is.
That's really what it is. It's inside and out. You're absolutely right. And I just want to invite everybody listening, watching to please keep those questions coming. Yes. I'm loving this. I'm loving the questions.
Yes.
And I don't know, this is just so much fun. And obviously, Dr. Nassif, where can everybody reach you on social media?
It's Dr. Paul Nassif most of the time. And I think now we also have a TikTok. I think the same thing. Just look for the little blue verified. Just like you have yours too.
Yep. Same thing with me.
Verified.
I'm M Westmore pretty much everywhere.
It was great. And then we will see everyone next week.
Bye, everybody. Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. If you have any questions for future episodes, please don't hesitate to reach out to us on Instagram at DemystifyBeauty or email us at demystifybeauty@gmail.com. And don't forget to subscribe, rate, and review the show. See you next time.